Only on Friday, and you are permitted to make such slips. So see when I was
nitulie tu.
Yeah, just keep making them
panic.
Make correct, then move on.
Yes. All right. So again, you're with City Muga and myself, Mungala Mbuvi. We want to have a conversation around cervical cancer and what we do not know, and perhaps what we know or what might be a myth. Perhaps Daktari in studio will help us demystify it. I'm talking about the Deputy Secretary General of KMPDU, Dr. Dennis Miskellah, who is also a gynecologist. Daktari, karibu tena sana once again to Radio Generation.
Thank you so much, Mbovi, for having me.
Yes.
And I'm happy to come and discuss something different from maandamanos and demonstrations on the street.
But I will ask you, even if it's for a minute or so, the situation in Kiambu County, surely it's now, I think we are heading towards day 100 if we've not already passed it.
Yeah, we're in day 95 today for the Kiambu County strike, and it's very, very unfair what we are putting the citizens of Kiambu through and also the doctors through, because the issues the doctors were raising were very valid issues that we had confronted last year and agreed upon with the county. The court had ordered them to be implemented, and the governor and his people just decided to backtrack and not keep their words, and now they're sitting back and watching patients die, watching people suffer. And this gives us more reasons sometimes as a union why we demand that there's somebody that the governor should be accountable for. This idea that a governor just think that they are the local gods in their county, they can do whatever they want, is a very, very unfair thing. And it runs at the backdrop of the governor having a very, very lavish event celebrating his county, collecting 5.4 billion shillings in a year from on-source revenue. So we ask ourselves that if you collected 5.4 billion shillings, why can't we just implement the few things of which those who help to collect that money? Because I can assure that the majority of the own source revenue comes from hospital charges and all the money created within by healthcare workers. So then if you're going to praise them for their output, then you can facilitate them for their input.
Yeah. We spoke with your colleague from Central Region, the rep in that particular region. And one thing he said is that some things they have come to agreement with. There are some they just need to iron out. But that was over 2 weeks ago. And I'm asking, how long do negotiations talk? Is it when you munongianga in the middle of surgery ama ni aje?
You know, the thing is that if you're negotiating in good faith, then you can really make progress. Kiambu County doesn't negotiate with good faith. Most of the gentlemen and ladies they bring to the table are people with very fragile egos. So some of and they feel bruised and they feel like we wronged them by going on strike. So the main issue we are fighting about are only two. Where we are telling them that you need not to victimize the doctors. It's called the non-victimization clause, which exists in every strike, every legal strike. And this Kiambu strike, even the courts told them that's a legal strike, must end with a return to work formula, say that you will not victimize the doctors, either by transferring them, either by holding their salaries, either by even interdicting them or even sacking some of them. You know, that's why I don't think they have refused, because they intend to do that, because I know that the governor is a very, very vindictive person. From previous engagement. The other issue that we have disagreed upon is the issue around the union deductions. By law, the law orders every employer that once you have recognized a union as a representation of your employees, then you have to deduct part of the money when the doctors request of it and give it to union to support the union. And if the members don't agree, then you deduct agency fee for anybody who benefits on what the union has negotiated. And the governor and his team have refused to acknowledge that that is what the law says. And they say that if you want them to deduct, then you have to then resign people afresh and make them agree to contribute. But we already gave them those forms almost 10 years ago. So they just had to make our lives hard, and those are the two major issues. And you can see that they're very simple issues that if people cared more about the citizens of Kiambu and less about their egos, could be solved within a day.
Well, Daktari, I hear what you're saying, but is it just egos alone? Because here you have a situation which you have logically put across and not very difficult to understand. And then you say it is a legal strike, implying that there are strikes which are not legal. I'll come back to that. But when someone is adamant about a particular point, and even when it's logical, they seem to agree and then they turn back, are we only dealing with egos here, or are we dealing with something else?
I think why in my diagnosis I thought it was ego, because you cannot say that you don't have the money, because this money we are asking of you is not your money. It's just deducting members' money and remitting. Yeah. So and the other issue is that the law is also there to provide for that. Yeah. And the courts have also pronounced themselves on that. So I don't think it is incompetence, because some of the people we are engaging are also very, very competent people. Yeah, they have their county attorney plus 2 other external lawyers. They have their chief officer, who is a surgeon for that matter. They have their CECM, the minister for health in Kiambu County, is a doctor for that matter. Yeah, so I really doubt if it's about incompetence or lack of money, because those money, I've told you that money they budget of collecting 5.4 billion. Yeah, so it's purely just I don't know.
All right,
someone's ego.
Yeah, we'll circle back to that perhaps at a different time in a different conversation, but I think someone needs to be held accountable, City, when all is said and done. Lives have been lost.
Who would hold the governor accountable?
We will decide it when that time comes, because
the time is now, because it's not as though people are not suffering.
When the dust has settled,
this dust doesn't need to settle. If it settles, more people have died.
When the dust settles, and I hope it settles very soon, someone needs to be held accountable. We just sat here with I think his name was
Dr. Bill.
Yes, Bill, yes. And he told us there's an 11-year-old child. Kwanza hiyo siku alikuwa amekuja, it was like 2 days before a child had died. And City, that is one person too many.
Let me ask you, how many people do you think have died since?
Let's talk about cervical cancer. Yeah, because I'm sure people in Kiambu are listening, and some of them might be affected actually by this situation of the strike. So, cancer, cervical cancer to be specific. We have an idea of what cancer is, but how does cervical cancer manifest itself? Because we know other cancers, it's either a tumor or actually I don't know what else. How does cervical cancer manifest itself?
Yeah, so thank you so much, Bobby. I had to make this discussion as simple as the I'm dressed. Yeah.
I actually thought you'd come with scrubs today.
No. I wanted to make, you know, sometimes people, when you come with those hospital gowns and all that, then you lose them. Yeah. Also, some people will think that you're going to discuss so much jargon and so much science that they just switch off.
Yeah.
So I'll make it just like a normal kawaida talk, but with facts, not fiction. Yeah. So first of all, what is cervical cancer and what is cancer? Cancer generally is when you have cells. You know, in our bodies we have cells keep on multiplying. That's what makes somebody to grow tall. You're multiplying. That's what makes somebody to grow fat or thin. Get that? So annually we are replacing cells. When you have a cut in your hand for that wound to heal, it is cells multiplying and all that. So any cells can multiply, grow, die and all that in a programmed way. So whenever this program gets out of hand, the cells go into riot. Yeah, they start invading areas that these cells were meant to just be on the skin. Now they are in the muscle. These cells were just meant to be within a certain level or layer. Now it's growing beyond it and now spreading to other organs. Then they call that a malignancy or a cancer. Yeah, cells growing out of control. And so it can occur in any different body. You can have cancer of the bone, cancer of the breast, cancer of the cervix, all that.
Even cancer of the eye.
Yes. There's what called retinoblastomas. Yeah, of the skin, the melanomas. You get that? Yeah, so cancer can occur anywhere. And in Kenya, the cancer burden is quite high. Almost 50,000 cases are diagnosed every year. 30,000 of them.
And this is new cases.
New cases every year, 30,000. And out of these, almost 30,000 of them die. So you can see, in case of cervical cancer, we lose 9 women every day to cervical cancer.
9
women die every day from cervical cancer.
In Kenya?
Yes. And why is this cervical cancer? In a woman's reproductive anatomy, you have the uterus. Uterus is what holds the baby, what carries the baby.
What we call the womb.
The womb, yes. So the entry, the door to the womb is called the cervix. And you must know the difference between the cervix and the birth canal, which you also call the vagina. Yeah, there are two different.
So the vagina is the opening.
The opening.
Okay.
Then once you go to the vagina, you then access the womb, and the entrance to the womb is the cervix. So this cancer occurs within the entry point of the womb. So
between the vagina and the uterus.
Yes.
That space is called the cervix.
Yes.
Okay.
And it's different because there's also vaginal cancers also exist.
Aye.
Yeah. Yes, there's also vaginal cancers and all that. So these cervical cancers, I told you that any part of the body can get cancer.
Yeah.
Yeah. So when the cells around the entry to the womb start growing out of control, then you end up with cervical cancer. And as I told you that amongst the cancers in women, the most common cancer in Kenya amongst women is breast cancer.
Okay.
Quickly followed by the cervical cancer at number 2. Yeah, we diagnose almost 5,000 cases of cervical cancer every year.
Yeah,
you get that? And I told you that 9 of women will end up dying. That so what happened, and so what are the risk factors? First of all, that what would make a woman
get cervical cancer? Yeah,
cervical cancer, luckily enough, is one of the most easily treatable cancers in the world. In fact, in some countries out there, they have eliminated it. Why?
Completely.
Yes, because cervical cancer has been shown to be caused majorly. The cause is known by the human papilloma virus, HPV virus. Yeah, which many a times is sexually transmitted. Yeah, and you always find that when you screen it amongst women, the screening is done for women who have started engaging their sexual debut. Yeah, the sad thing about this human papilloma virus that causes this cancer is that, unlike gonorrhea or syphilis that will come maybe with a discharge or a smell, this virus has no symptoms, so you can never know.
It's a phantom.
Yes, and it can stay in your body for as long as 10 years without causing anything. Then one day it happens, because this virus, when it infects the cervical cells, it gets inside the cells and integrates into their DNA. So when the cells start multiplying, they start multiplying in a very, very confused way, no control, lack of order. Then they riot and start spreading across. And why it's important for us to talk about today, that if you are able to pick up this infection and these changes early, then you can save lives. If you pick it up late, it becomes a little bit tricky.
So how okay, I know there's the pap smear, which is where now part of the screening is involved, right? Yeah. But how I can take a pap smear today, okay, a woman, not me. A woman can take a pap smear today and then tomorrow get infected with the HPV virus. Or perhaps as a doctor you do not detect any cervical cancer, or what exactly, when you're doing the pap smear, what exactly are you looking for?
Yeah, a good question. And at this point I must tell our listeners that this discussion is for both men and women.
Okay.
You know, many a times as men we try to keep off matters of women health, but we realize that in our society men are more empowered. It's the men with the radios, yeah, it's the men with the remotes, it's the men who get to a chance to listen to all these as women are out there cooking, preparing the kids for school and all that. So any man who listens to this discussion should also switch the stations. They must learn and then go for their young daughters, their wives, their sisters, their aunties, their mothers, and teach them what we're going to discuss today. So yes, the easiest way to fight cervical cancer is through screening, early detection. First of all, let me start. The first in cancers, there are 3 ways of preventing it. There's the primary prevention, then the secondary prevention, and finally is the treatment and avoidance of death and mortality and morbidity. So in preventing people from getting this cancer, we need to of course encourage issues around having protected sex, so that this virus is caused by virus and sexually transmitted. Yeah, that's very, very important. Secondly, we must make sure that we vaccinate our little girls before they start engaging in sexual activities. In Kenya right now, we are vaccinating between the age of 9 to 14. Okay. And I'm so proud of what the government has been doing. We now have school-based programs where we go to schools and vaccinate these kids. The only thing we need from home is the consent from their parents. Most parents who know what we're talking about are happy to consent it. But those who are ignorant will say, oh, these are our children, they want to sterilize them, or wanataka kuwafunga wasizae, a lot of theories and all that nonsense.
Yeah.
But the only thing we want is just to vaccinate them with this vaccine. And it is for free. So
it's free?
It's free. The free vaccination. We are doing a mass vaccination program, and a recent program. Yeah, because we realize that if we don't do that, those who don't get this chance, somebody asked me the other day that, can an older person get the vaccination? I said yes, but you have to pay. It's a very, very expensive vaccine. Yeah.
How much for?
A dose can go as high as 12,000. Yeah.
How many doses?
It take 2 doses. Although right now we are trying to roll out one that only takes 1 injection.
Okay.
Yeah. And it's 6 months apart. So any girl who has not had a sexual debut, a girl who is a virgin, can get that vaccine.
So even a 30-year-old virgin can get it.
Can get it.
Ni venye saa atalipa.
Yes. We are assuming that if you have not had sex before, then you are not being exposed to the virus.
Okay.
So the vaccine can help you. Although research shows that even those who are not virgins, who have had a sexual debut before, it offers some level of protection, around 40%, which is still better than nothing. Yeah.
So question here, Daktari.
Yes.
Can boys get this vaccine as well?
Thank you. That's an A+ question, City. Yes, boys should get that vaccine. In a perfect world in the West, they're vaccinating both boys and girls. But in Kenya,
we are third world.
No, we can't afford to vaccinate both.
What do you mean we can't afford? The cost of treating a patient who has cancer, mirror it against the preventative cost of ensuring that you limit the possibilities of infection. Surely that balance.
And I agree with you. That if you look at the cost-benefit analysis in the long term, that could be a good reason. But in the background where you have this limited resources being given by our benefactors, then you have to check. These boys will carry this virus and they can risk of infecting others. But if the other person on the other side, the partner, is vaccinated, then they're not going to get cancer.
Doctor, correct me if I'm wrong, but doesn't HPV also cause penile cancer?
No.
It doesn't.
No, what have been shown to cause that it can cause throat cancer. Yeah. But the main issue that, well, if you look at the numbers, is the whole cervical cancer and who does it affect the women. Yeah. And that's that in the West they vaccinate both of them. Over here, like at home, when you have that one glass of milk, do you give it to the newborn or do you have to dilute it for everybody in the family? So that go to the whoever needs it the most.
Daktari, next Friday,
yes.
Wacha hii ya kesho, wacha hii ya leo, the coming one.
Yes.
I am burying an uncle who actually died of throat cancer.
Yes.
If my uncle had received that vaccine when he was born, I don't know if it was available then, probably my uncle right now would be very much alive and thriving. Probably, I don't know.
Probably not, because throat cancers are also caused by varied issues, and that discussion can have another day. Yeah. For now, I think the key thing is that we must scale up.
Yeah.
We must scale up the vaccination. It is picking up pretty well, but there's some resistance in some quarters with some parents, and also the vaccines are not easily available. Sometimes there are schools who don't access it. So I tell those parents to go to the nearest level 3 or 4 they are available with their children and get vaccinated. If you have a child who's older than that, 14 years, they're in high school probably, take them there and pay for it because it will save their lives. That's one.
Dr. Let me just ask before you continue.
Yeah.
Is this vaccine available all over the country?
Every time I ask this question, I'm told that yes, it is available. Yeah, where I work in a small facility somewhere in Embu, they tell me that they have the vaccine. The good thing about the Kenyan health infrastructure is that we are pretty good at how the cold chain and how we transport our vaccines. That's why you see, even the remotest of part of this country, people get their polio vaccine and all that. And as long as this vaccine is rolled out as a national program, when you're going to pick up the polio vaccine, you always get the mother touch and all that. The biggest challenge, I've not even heard people complaining about the availability. The biggest challenge has been the acceptability. Yeah, because nobody has taken time to talk to the parents, to explain to them.
I was coming there next, so please go on.
Yeah, nobody has taken time. Even the campaigns, we hear campaigns about kicking polio out of Kenya, kicking this out of. Get that? We have polio people walking around knocking doors and everywhere. I've yet to see the same be done for the HPV vaccine, but I suspect because maybe the doses may not be adequate, so they are scared of creating the need too much, that the demand is too high, that overruns the supply. So I agree with you that maybe that would be what could be informing the way government has not aggressively campaigned against for the vaccination of this virus.
But anytime we've had vigorous campaigns,
Puana, some of these things I hear and I'm like, it's crazy, but yes, continue.
When we've had vigorous campaigns on diseases, a lot of it is not the government's initiative. It has to be funded somewhat.
Yeah, of course, it's really disappointing about how we run our healthcare programs. Our healthcare programs are heavily donor dependent. Yeah, we depend on the goodwill of other people, and of course, you've seen the Trump politics and the funds. Yeah, the Global Alliance for Vaccine Initiative, Gavi, is struggling. The Global Fund is struggling. USAID is struggling, and their partners are really gone out of their way to really support most of our vaccine program. And I believe that if we put our money where our mouth is, we could do much better. Because right now, most of the monies we are spending at the ministry is on useless conferences. The traffic jam in Naivasha is full of government officers going for conferences. Yeah. So if we invested more in where the need is, probably then we would have more women, and we can even be giving boys this vaccine. Get that?
You see, the preventative aspect of healthcare and the need to focus. Yes, I understand the commercial interests and how very prevalent that is and how very pervasive that is. But the affordability is nestled in the simple fact that the curative aspect of healthcare is what we focus on. And that there's no country in the world that can afford it. It's not just Kenya.
No city, that's something that as a union we have always pushed that wahenga au kwa wajinga wakisema kwamba it is easier kuzuia repairing a crack than repairing the entire wall.
Yes.
Yeah? The biggest
Usipoziba ufa,
yes,
utajenga ukuta.
Yes, you get that. And the cost of care in this country is getting away because we are focusing more on curative healthcare. And curative healthcare is so expensive that nobody can afford it. And you said, well, even in the West, that's why they are pushed more towards prevention. These issues around vaccination, these issues around early detection, the screenings, it's just to prevent. Cancer is very expensive to treat if picked late.
Let me ask the question: how expensive is screening?
Screening, and I was getting that about the screening method that are available for the cancer. Yeah, screening is available from the cheapest method, which is called the visual inspection under acetic acid (VIA), where we can do this from a dispensary level. All the where when the woman comes and we just need to paint acetic acid on the cervix and observe the color changes.
That's it.
Yes, and these are available in 92% of the facilities in the country.
And what is the margin of accuracy with this test?
It's user dependent. There's somebody looking at what they are seeing. You get that? And so based on how well trained are our healthcare workers to pick it up.
How then
Yeah.
do we train health workers, and how do we have a sufficient body of health workers who are trained and who can able to provide, and how complicated is the training?
Yeah, and that's the thing. We have in the recent times, I think the last 3 years, the government has taken a serious initiative towards cancer, and we have the National Cancer Institute, which has gone out of its way to really offer these training programs on the VIA. Yeah, but then again, we have the next. That's for like what we do even in medical camps, when we are doing in the dispensary level, community level, and all that. Then after that, we go to the next level where we have the pap smear. Pap smear is now where when this woman comes, we take a brush and brush around the cervix, and the brush will hold some cells into it, and we put it on a slide and look at it on a microscope to see if the cells have begun those changes. Get that? That one is available in level 4 and 5s. Is a slightly complicated thing because you need a pathologist to read the slides. Yeah, so that one is always only around 4% available in the country. Yeah, so and even in public hospitals it's very, very rare to find because we have very few pathologists around. Then in the third level of screening now, which is very, very complicated, at least or expensive, is the DNA testing, where we take the cells again and check whether we have the HPV DNA integrated in the cells already. That is done most in the West and is the most accurate one, because then you're now literally picking up the HPV DNA. Yeah, so those are the 3 ways you can screen for this. And question somebody listening might ask that, so what are these risk factors that can predispose me to me getting this cancer? Yeah, because maybe there's somebody there wondering what's going on. So first of all, it's always the multiplicity of sexual partners. As I said, that you might not even have them at the same time that you have 3 boyfriends or 4 husbands. No, but it could be that maybe over time you have had more than one partner. So it increases your chances that one amongst them probably is having carrying this HPV. That is one. 2 is HIV. How normally our bodies will always misbehave. The cells are, we are not in some computer programming that everything works like a clock work. So our bodies are made that we have an immune system that fights the police of the body. Where anytime
the armed forces,
yes, where anytime this riotous cells start misbehaving, they take them back into a nice narrow.
They are brought to order.
Yes. So when your immunity is low, like in immune deficiency cases like HIV, where these cells can now become aberrant, they start misbehaving, and there's no police to check on them.
They have impunity.
Yes, they're going out of hand. Yeah. So in HIV patients, they are high. In fact, right now the most common thing, the HIV cervical cancer co-occurrence. Yeah, such that there's a program. Yes, where in USA they put a program where when our women come for their CCC, comprehensive care for their HIV medications, when they're coming for their CD4 counts, we are also doing pap smear together with them to just ensure that, because they are concurrence, they're high. I'm not saying that everybody with cervical cancer is HIV positive. Let's not get us wrong. Yeah, but
and start panicking.
Yes, start panicking and look at each other finally across the breakfast table. No, we're just saying that it is highly that anti-immunity is low, then you will most likely find yourself, and that's why you see that cervical cancer cases is high along like the HIV prevalent regions, like around the Lake region, yeah, around Homa Bay, Kisumu. See, the numbers are higher than what we find maybe in the north, yeah, areas. So HIV is very important. The sexual partner is very, very important. And because of that, we try to do this targeted kind of screening. For example, while pap smear, we can tell women to do it every 3 years if you're not HIV positive.
Yeah.
For the HIV positive, going to start screening a 14-year-old with a virgin. Why will you put the speculum to even to check on the cervix? You get that? So from age 21 to age 49. But for those at risk, we push it up to 65 years. So if at 65 years you get there without any issues, cancer in the pap smear and all that, we can set you free. Most likely you won't
get
have issues. Yeah, but those who are younger, they do it every 3 years. And women, one thing I know for sure that even the women listening to this show will tell you that from what they hear in the salons, chamas, is that pap smear is painful. Women really don't like speculum and all that. But if you think pap smear and the speculum is painful, then try treating cervical cancer. It's one of the most humanizing cancers I've ever met around.
Yeah,
because cervical cancer will come with certain symptoms that, first of all, you start with this pain. You have this foul smelling discharge. You can't sit in public. Your husband or partner has ostracized you. Yeah. And the fact that it sneaks up on you, that one day you have this discharge. And this brings with the signs and symptoms. Probably people will ask me, where you have this discharge. And the sad thing is that you'll go to this lower level facilities and in UTI or in
they
STI,
start treating for UTI.
or it's fungal infection, antibiotics, back and forth. And in fact, for me, I no longer even blame patients. You know, kitambo we tell patients, oh, you came late, you came late to kuja mapema. One day a patient told us in some cancer conference in Safari Park that we are tired of being blamed for coming late. Most of us come early, and true, as a gynecologist, I'll tell you this: women, when they notice anything wrong with their bodies, they come earlier than men. So they go to this dispensary, health center, they get ill-equipped healthcare workers who gives you antibiotics, go back, oh, fungal. So by the time this mama is reaching me as a gynecologist, is 1-2 years later, this thing has spread, and she feels so betrayed that I wish nikiambia mapema. So this discharge, foul smelling discharge that doesn't go away despite treatment, must make you come see a doctor. As a patient, if you keep on going to the same place unapewa antibiotic na uponi, please escalate. If they want to refer you, refer yourself to the next level. 1. 2, anytime you're having sex with your partner and you're feeling pain, or anytime after sex you have some spotting or bleeding, you need to get worried.
Okay.
Anytime you are seeing spotting or bleeding between your menses, a woman should only see blood when she's menstruating. So this intermenstrual spotting and all that should get you.
checked.
Yeah, any unexplained pelvic pain should get you checked.
Pelvic pain is pain around the waist.
Yes, the lower abdominal kind of pain. Yeah, it should get checked. Yeah, but you don't have to wait for that. By the time you are getting those kind of symptoms, many a times it has moved to a certain stage that is getting a little bit complicated. And because I said that this thing can be silent for almost 10 years without you ever knowing. Yeah, that is, screening is very important, because you catch cervical cancer in the early stages, stage 1. Very easy to treat. Sometimes are so simple to treat that you just take a hot wire. Of course, I'm saying in a layman's language, but the way it's done, and we just cut the lining of the cervix. Yes, just as simple as just taking an ultra cold iron piece of metal and just throw the cervical entrance, and the cryotherapy just heals it. As simple as sometimes just need to just remove the cervix and you're good to go. But to catch it later, it has spread beyond 2A stage. Then even sometimes we don't even want to do, we can't even do surgery. And this brings me to the part about the healthcare workers, that you find yourself in a facility where they have diagnosed with cervical cancer, and instead of them referring you appropriately to a proper consultant, this surgeon or this medical officer or whoever it is tells you that they have to do for you a surgery. And we see these patients coming at a higher level hospitals where at the lower level they do the surgeries and remove the uterus. But when this cancer, I know patients ukishatoa uterus anasema nilipona nilifanywa upasuaji, kumbe the cancer had spread beyond the cervix. So she sits back thinking that she's healed,
kumbe shida ingine inaendelea kumea huko.
Yes, or they come and in the treatment, sometimes apart from the surgery you can do chemotherapy, unakaa dawa kwa damu, na bado kuna radiotherapy, kuchoma the
with the laser.
Na kuchoma hii radiotherapy unahitaji the some particles you need to, the isotopes unafaa kuweka kwa uterus to hold them. If somebody made a mistake of removing that uterus, we have no pocket to hold those radioactive isotopes. So you can't get the benefit of radiotherapy if I knew radiotherapy, because uterus hakuna. And that's why it's important that when somebody diagnoses cervical cancer, they must refer so that the consultant will know, is this stage for surgery or it's beyond surgery? Now we just need to do chemotherapy and radiotherapy.
Okay.
Dr. You mentioned multiple partners as being one of
risk factors.
What are the others?
As I said, that the other factors I talked about, the HPV infection, you can still be infected without having multiple partners. It could just maybe that first husband you met, that probably was a carrier. You get that, or that first boyfriend who gave it to you. I also talked that immune deficiency. Patients with HIV are at higher risk of getting cervical cancer, because while they can routinely get the virus like everybody else, their bodies won't be able to fight this virus like everybody else would. Yeah, because not every virus survives to the point that it causes cancer. Some of them, the body just fights them off and overpowers them, and you just proceed with your life without ever getting this cancer.
An early sexual debut, does it also point towards one of the things that brings about? Definitely. When anything sexuality, for early sexual debut means that you began having sex much earlier. In Kenya right now, the average age that girls are having sex around age 14, which is pretty low. Yeah. So how does it bring the issue? Age 14.
Yeah. So what does it bring? How does it come around? If you got exposed to this virus through sex early, quite that the virus can stay 10 years in your body before becoming cancerous, right? So it means that you got exposed early, so your 10 years probably get, but if you got exposed at age 11 or 12, so by 22 you have a cancer. And I've seen even 18-year-olds with this cancer. Kitabo used to think about a disease of 40-year-olds and all that, but with more young people have
engaging sex,
yes. So you get this cancer much earlier. But also important that when you start engaging in sex at a very young age, what does it mean? You are going to have so many partners. By the time you are getting married at maybe 25, you have had almost 10 years, 15 years of having sex. So you are at a higher risk of multiple partners than those who probably broke their virginity at age 21 or 22.
So if I to follow that logic, then it means in part of the country where people favor the marriages of young children, I'm calling them what they are, because they are children.
Yeah.
So the likelihood of seeing this particular problem, it is likely you'll see problems of this nature in some of those communities.
Could be inferred, but the data science doesn't know as the other co-founders. Yeah, like in the north where you have these younger children, probably being married young and all that. Yeah, but then again, the other mitigating factors like this girl will most likely have this guy who married her all through her life. They're not going to be because
of not have multiple partners
because of culture and religion and all that. Yeah. Or in this case where she gets exposed to this earlier, but maybe the HIV rates are lower, so the immunity is still intact. Yeah, because that's not every viral infection ends up with a cancer situation. Yeah.
All right. I want to go back to that question of research.
Yeah.
I feel like, and this is the truth, Africa, we rely so much on the West to give us these medicines that we need and the vaccines.
Yeah.
Why is it that we are unable to manufacture our own vaccines and also just medicine for any other infections? But today we're talking about cervical cancer. Why haven't we just had our own research on cervical cancer and then make our own medicine? And actually the research is already there, so that means the medicine is already.
Yeah, of course. I don't know what is really wrong with in Africa. Politics and governance issues take charge of everything. For a country where we still import toothpicks and matchboxes, you think that they can even fix the most basic of basics? We can't.
We have 54 countries in Africa. If all those 54 heads of states can just come and say, guys, can we set up a cancer whatever research center in even Ethiopia or Sudan or Kenya, Uganda, na tutengeneze dawa zetu zenye zitakuwa zinatoka hapo at a cheaper price, such that we don't have to think about waiting for America or Pfizer or I don't know, Bill Gates to come and give us vaccines for free, whereby we also don't have to think about them wanting to control our population through sterilization. Hii ni yetu for us.
Yeah, of course. Sometimes we will all wish that our leaders gave healthcare the priority it deserves. But we have this over reliance on the goodness of the West. And it's a sign of leadership failure. And that's why I support this Trump idea of stopping funding some of these things in Africa. Because Africa is not poor. Africa just have poor leadership. Yeah. 20 years ago, they met in Abuja and said that 15% of their budgets will be put on healthcare. Only Cape Verde implemented that. In Kenya, we are even doing worse than that. People know what is wrong. People know what should be done right. Because these things have worked in the West. But they don't just do what is right. Africa CDC has tried to push it for them, but remember that the disease burden is so high that before somebody puts their money on cancer, they have to think about the infectious diseases, the malnutrition, the HIVs of this world, the TBs of this world. Yeah, so they ask themselves, where do we want to put this money? So the challenge really goes to our governments, wherever they are, that it's high time we looked within us for the solutions. I believe that, like in Kenya, we have already the resources, in the human resources, people already trained some of these things. Of course, the numbers are not enough. We have a severe shortage of cancer doctors. We only have 100 oncologists in this country, against a population of 55 million. Yeah, so you can just imagine and if for one oncologist, a cancer doctor, to handle 550,000 people. Yeah, and many times I see it in patients, this stress when you are told you have cancer and they don't know where to go to, they don't know who to see. Then somebody comes in to fill in that gap and say, let me pray for you. And then says, kunywa miti shamba, kunywa dawa ya Masai.
Wacha tutoe mashetani.
Yes, mashetani, all those kind of things.
Yeah.
Because of that severe shortage. So yes, we have to train more, we have to invest more in some of these things, so that in the long term we'll be like cervical cancer. As I say, that the cancer is almost getting eradicated in the West. Right now, if you hear about cervical cancer in the West, is more probably an immigrant who went already having those early things going on, early changes going on.
How are they taking care of it? Because they started the vaccination early?
Vaccination. Pale, they know it. A baby, a boy or a girl turns 9, you're having your vaccination. So they are, then still they still do their routine screenings. You still, the fact that you have got a vaccine, they don't stop you from still doing your pap smears. For them, they do the DNA one, which is more accurate. You get that?
So what we're saying that here in Kenya, boys can still get the vaccine. It's just that it's
But you pay, yes.
expensive. Yeah.
If you have a son, like I have a son, who is almost getting to the age that I want him to get the vaccine,
Yeah.
I'll just take him to one of the facilities and tell them to vaccinate him, not for himself per se, but for the others
Yeah.
that may interact with him one day in future and get infected.
Yeah, and that's very critical and that's very important. Focusing on the preventative aspect of it now, and I want to get into the politics of all this.
Before you get there,
Yes.
I'd like to ask a question. You know, if you talk about the Abuja Declaration and the implementation, as of this year, there are actually 3 countries: Cape Verde, Botswana, and Rwanda. Now, the case study as to how they did it, because they did it, how did they go about doing it?
But if you look at those countries I mentioned, it's almost down to leadership. There are times back when Botswana didn't even have doctors. Kenyan doctors in the 90s, they are really moved down to Botswana because the country intentionally drew them in by paying them and incentivizing them going there.
In fact, all those small countries in South Africa, in the southern part of Africa,
Yes.
it's not just doctors, even civil servants.
Yes.
They actually, Kenyans.
Yeah, we
well,
went there and fixed those systems. Yes, because they intentionally put resources to incentivize people to move there. Look at Rwanda.
Yeah.
The leadership has been very, very intentional around preventive medicine. They don't have an entire university just for global health. You get that? So yes, leadership, and it's not a miracle. The kind of monies we are leaking out in wastage and corruption, if properly directed, would do a lot of good things in the health sector. But no, we are not investing enough on that because of just our selfishness. People are just greedy. Because why would you have 170 billion of the budget in Ministry of Health when healthcare is 90% devolved? Yeah, what is that money doing in the headquarters?
Yeah,
You get that? So it's very, very important for us to. WHO talks about in the pillars of universal healthcare that after you've had the infrastructure, the healthcare workers, the drugs, the ICT, and all that, they are tied in a bundle called leadership and governance. Where if you have a president who thinks in the correct direction, then you have a minister who thinks the right direction, then you have policymakers and MPs who think they're along the same way. Then they put structure in places, structural improvement that ensure that the thoughts are aligned. But we still have children dying from basic illnesses like pneumonia. Then do you think they got malaria? Do you think that they're going to worry about things like cancers? And many times our leaders also think that this is some utopian disease that only affects the poor, so it doesn't affect us. Some of these policymakers tend to think and focus more on diseases that affect them. Yeah, so they say that I've got cancer. Me, my children, my wife goes for their pap smears. Are okay. That's not my problem. Yeah, but what about those who put you there? So yeah, leadership and governance are the biggest challenges in healthcare response in this nation.
Siti unaona ile shida tuko nayo.
Hiyo si shida.
Hiyo ni shida Siti, because
si shida.
you see ni shida.
Si shida.
Ni nini?
What you're referring to as a problem is how we have deliberately allowed and normalized the very, very things that we know will work against us.
Yeah.
My position in this matter, you know, because I say it every day. If we refuse to hold those we elect and those whom we pay, if we don't hold them to account and we don't make them understand that they are accountable to us, then we deserve everything that we get, in all honesty.
Yeah.
You know, sometimes City, why I fully agree with you to a certain extent and then disagree with you to a certain extent is that we assume that the electorate, that they're so empowered that they can see through
I keep on telling Siti
and
that.
decide, say that these are good leader, or even holding people accountable. Many people are not empowered to know this. I think I'm so proud of the Gen Zs that are seeing the current problems, that they now have people not empowered. They might be just a poor hard boy in the village, but they have a smartphone. And they're able to access, and they went to school at least at class 8, and they dropped somewhere in Form 4, if they failed in Form 4. They have some knowledge. But for the longest of times, we have not had a population that is empowered, and intentionally so. Secondly, that people have refused to connect the software challenges vis-a-vis the hardware challenges. So the politician will come that people want roads. Nimewekea barabara, nimewekea bridge, nimewajengea KMTC in your constituency. Hardware. When it comes to the software issues, people don't think the correlation that, for example, that if you elect somebody who's previously corrupt, who's previously charged, who carried a DCI bango on their X page, that if you elect them, they become thieves. They want to change and become angels. People don't understand the connection between healthcare and the vote. People still think that healthcare, when you fall sick, is your problem and your family. That when you die, it's a very private thing. That death so private that is your problem and your family. They never correlate that how bad leadership influences death. That if you have a bad leader, then you end up having 5-year-olds dying, newborns dying. Then you're being told that God has picked a flower from his garden. How come God only picks flowers, 5-year-old flowers in Africa, and in Japan he takes 100-year-old flowers? People don't understand that those roads, when they are built without the attendant budget for healthcare, you'll use them to carry your sick to hospital and you're dead to the graveside. So people must know that before this hardware stuff we are so crazy about, can we just have, I'd rather have an ignorant child living to 100 years than a dead professor at 35 years. So this thing of investing 600 billion in education to educate children, then they are dying from malnutrition, makes no sense. And it's up to the people to say that please, can our dispensary have drugs? Because the governors, they have done a very good job. Right now, Kenya has achieved the GDP for health infrastructure. They have achieved the WHO ratios. That within 5 kilometers in this country can access a health facility. But they're just buildings. There's no drugs inside. There are no workers inside. Why? Because there are tenders for constructing them and kickbacks for constructing them. But there's no kickback in paying somebody a salary or employing somebody. So they don't employ them, they don't hire them, and that's the biggest challenge.
And that's why I'm for the, anyway, we'll talk about the politics later. There's Eunice Kyoko on YouTube amesema, how many oncologists Guy and our Gava is doing zilch. How many oncologists do we have? 100 in Kenya.
100 in Kenya, and
in a population of 100 million, 50 million.
Yes, and it is terrible because some of them they are for different. They're also different oncologists. Like the one for cancer is a gynaecologist. Like for me, I'm a gynecologist, so I have to go back to school for another 2-year fellowship to become a gynaecologist. So there are different types of oncologists. So can you just imagine how severe the shortage is?
Yeah.
And even just the shortage of qualified medical officers, with the latest ratio was 1 to 17,000. Yeah. So many a times, even as we talk about this thing of preventive measures, how many people get a chance to get a qualified doctor to tell them what to tell them? Or how many people even get a chance that once this suspicion, this what I've talked about as symptoms here has been seen, to go and see a doctor who can pick it up and refer them appropriately? How many people can get a chance to get a qualified nurse who is well trained to do a proper via villi, or be it a pap smear, or have a pathologist to have a look? So it's a serious human resource challenge in this country.
But the challenge is not only about the human resource who is trained being in the workplace where they are needed, but again the uptake of those who are already trained, whom we have, being put into the system.
Man, City, you're preaching to the Pope about catechism. Do you know we have 6,000 jobless doctors right now? When you're a Mesoma or a graduate or an internship, then they're dumped their city. Back then, government used to absorb them every year after internship. Now we had a strike in 2017, and somebody in their wisdom, not lack of it, thought that by stopping to employ them automatically, you're punishing the union or punishing the doctors. It's a very silly thing. That strike is what made us stop absorbing. You're not punishing, Miskellah. Mganga hajigangi. When I work in Embu, I treat the people of Embu, not myself. You get that? So yes, there's that huge number of unemployment. Then there's this immigration that once people are frustrated at their workplaces, right now we're losing almost 7 nurses in one of these facilities in this country per month to America. I know they take the best of the best. They take the oncology nurses, they take the renal nurses, critical care nurses,
they take the specialist nurses.
Yes. And in Ghana and Togo, they found themselves in trouble because the best of the best left. So these young ones are the ones who are staying around. I keep on telling them that don't tell me that you're doing bilateral trade labor agreements with America on workers moving. Because if they're coming for fresh graduates, that after a KMTC graduation day, there's a bus written London Express, then I would be clapping that you're creating employment for our people. But you can't be taking the best of the best, and they insist that they are those who have actually level 5 and 6.
Yeah.
They know what they want.
They know what they want. But as they're doing that, our governments are busy clapping and singing kumbaya for them as they go and boasting about diaspora remittance. Money is not everything. So we have to find ways of not just employing, but retaining, retraining, and motivating after equipping them properly. Because many a times I find myself with all my knowledge in this place where I work, and I don't have an ultrasound. I'm not a magician to look at a mommy's tummy and know what's going on with the baby inside.
Okay, I'm sorry.
Yeah,
I'm sorry, but allow me to laugh.
Yeah, it's crazy.
Yeah.
So you can also have these doctors and nurses there, and there's no acetic acid for the via veil, or you don't even have those things for doing the pap smears, or you don't have slides. So there are so many frustrations. All the vaccines are probably not enough.
Doc, let me ask, and I don't know how this question will sound. It might come off as stupid, but these 6,000 doctors that you've spoken about that are unemployed, if I'm a doctor and can't I just open my own clinic? How hard or difficult or easy is it for me to set up my own practice?
How hard it is that first of all, always a capital. You're a fresh graduate.
Yeah.
You just finished internship. Where your credit score that can make any bank even loan you that money? Where are you going to get this money to do this? Number two, when you have opened that clinic, how well resourced are you, the population, to afford private healthcare? People are broke, people are poor. So when you see like you have SHA coming up, is it enough adequately to fund private sector? Probably not. You get that? Because remember that the time you're opening a clinic, you're opening it as a business.
Yes.
And you have to charge as a business. I keep on saying that when you see somebody opening a butchery, they don't love you that they're selling you meat. They're in business. So yes. So whoever in that clinic, they're in business.
Doesn't love me.
Yes,
they're in business.
Those are Miskellah that don't have to open a clinic. I have to fight cancer. I'm opening a clinic. No, I'm in business. And in business, you'll put charges that sometimes
people can't afford. And it's true.
Yeah, and there's so many people whom you'll see today tell them, mama nimeona shida hapa na pale, kuna kwa hii via veila hii shula kwa acetic acid nimeona kuna makosa, enter next level 4 ufanywe pap smear, level 5 ufanywe pap smear, and they never go. Why? Kwa hiyo transport ya kwenda hiyo hospitali hawana. You get that? I know of a case where this lady, she was undergoing treatment for cervical cancer from Homa Bay, and on her way for her clinic, the bus broke down, and when she arrived, the clinic had been closed. So she was told, come next week. And this woman came crying. She was now said to me, I was in casualty, and she came crying, telling me that hata chakula sijakula mtoto wangu. So me fair hata kurudi next week mimi sina. So before we start even telling her how you want to help her, you have to first feed her first.
Yeah. That is her immediate issue, problem.
Feed her. Then she imagines the smell and the indignity of that disease in that bus and
for another week.
It's heartbreaking.
Yeah.
It's hard. And so that's how you even lose them. They never come back, and before you know it.
Doctor, there's a pressing issue here. Let me just ask real quick. We have like 40 seconds. Kuna DMCK admin ameuliza mbona no upgrading of facilities in Kenya by KMPDU? Why?
KMPDC.
Yeah, muuliza KMPDU.
No, hiyo sio kazi yao. Hiyo si wanafanya hiyo kazi.
Or facility. I don't know what he meant by that. That's why I've asked you.
Yeah, no, what I know is that people confuse KMPDC, the council, and KMPDU, the union.
Okay.
Yeah, so KMPDC is the one that regulates and decides which is at level 1, level 2, 3, 4, based on the number of doctors, the number of services they offer, and all that. Yeah.
Okay.
So KMPDC cannot upgrade, but they can downgrade, because you can, when you're opening, you can claim you have 10 doctors. Then you can put a license, you go and fire half of them for you to get that. So yes, downgrading
to maintain profitability.
Yes, but also as Kenyans, also we must stop this idea of looking at healthcare from a business point of view.
Okay.
And the other day I put some controversial tweet where I said that maybe it's high time we stopped businessmen from opening hospitals. I never see them opening law firms. Ushaona mtu amefungua law firm and never katika lawyers wafanye kazi ndani yake. No, it's lawyers who open them and regulate themselves. Same thing. Maybe if we left hospitals to healthcare workers, then healthcare probably will be affordable. Because when a businessman comes, amechukua loan wherever you have taken it, akafungua hospitali, they will have no say.
Okay.
The doctor cannot have a say even on the costs that are being charged. The guy wants money.
Daktari, thank you so much for coming through. I've learned so much, but please tutakutoa embu tena ukuje na tukikuita tafadhali kuja. There are a lot of issues we need to discuss, and I am for empowering doctors to give us better health care, because as it is right now, we might be over relying on the government, which by the way we should, but I think we need to find other solutions. Yeah, we honestly
how
do
you
need.
even over rely on the government?
That's why I'm saying we
It's
need.
their
We need.
job to be relied on.
As long as we pay taxes, we'll keep on relying on them.
Dr. Dennis Miskellah, right there, gynecologist, and also he is the Deputy Secretary General of KMPDU. The conversation has been around cervical cancer.